Hello. Today I want to comment on a recent publication published by, among others, a colleague I know personally working in Finland. And this is in connection to my topic that I discuss really often here on this channel about what possible treatments for depression might work aside antidepressants, which are always the #1 choice of any psychotherapist or clinical psychologist. They published in a brief report in Journal of Affective Disorders. It is titled Reduction of Symptoms in Patients with Major Depression Disorder After Transcranial Direct Current Stimulation Treatment, a Real-World Study. In connection to what we spoke here before, the overall effectivity of antidepressant treatment, both reported in 2017 as the conclusion from STAR-D study, which is a large collaborative study, and publications which were published in 2021 and 2022. I also had a link below to that specific publication. The effect sizes are pretty low for all known antidepressants, being old or new, or maybe newer, should I say. That effect size is not longer in any case on 0.3. I'm talking here about effect size, which is real-life, meaningful illustration of how large effect some therapy can have. And according to effect sizes, which are reported in newer history, because people are advocating for open science and reporting effect sizes, overall comparison of all antidepressant treatments are between 0.28 effect size and 0.3, which is really low. And if we are talking about any kind of talk therapy, thinking about any psychiatric or psychological interventions, their effect sizes are not much higher. Usually it is around 0.28 to 0.3. I'm talking here about effect sizes, not about p-values. The thing is that even when you combine antidepressants and psychotherapy, nothing changes. So the first two pillars, the basic two pillars of current psychotherapy, antidepressant medication and psychotherapy, even combined, cannot give effect size as the outcome effectivity of therapy higher than 0.3 effect size, which is considered to be low. The question is, what helps then? Some of the things that are accessible option today in many modern psychiatric hospitals and treatment centers are some forms of electromagnetic stimulation. I spoke earlier about repetitive transcranial magnetic stimulation, which showed to have effect sizes on some collaborative projects, which are, for example, there is one study from 2018 which compared effectivity of RTMS and tDCS in sample size larger than 8,000 people, showed that effect size of RTMS and tDCS are between 0.34 and 0.38, which is larger but not impressive either. But the data are surfacing, and the more people are applying those kind of treatments, we are closer to better understanding how they work and why they are effective. This novel study is important because it was also a collaborative study which actually analyzed how good treatment outcome for the patient was by use of transcranial direct stimulation, direct current stimulation, or short tDCS. This is non-invasive procedure, which is actually using very, very low direct currents, which are going through the skull with 2 electrodes, which can be done on your head. One is on the forehead, one is here, and it is that specific device that they used had a neoprene cup where the electrodes are already implanted, so even patient can use it at home. So basically Finland started first to apply that in all medical centers, small medical centers, where people had clinical depression. So in this study, they joined forces with other countries like Bulgaria and Estonia, and they actually collected pretty decent sample, which is, I think, more than 700. Total sample of patients is 462, but their highlights and conclusions are very important. I'm going to read that in order to communicate that the best. The highlights from this publication says depressive symptoms reduced after transcranial direct current stimulation. So we know that before, but what about the effect size? Complete clinical response was achieved by more than 50% of the patients. So this is exactly what is new here. This is the first study that I can see that somebody published on larger sample size, meaning larger than 50, and with such a large effect size. Of course, it is not only after one treatment. In average value of treatments in all those patients is something like 15, 16, which means that it has to be repeated. And as any other electromagnetic stimulation from electroconvulsive therapy to repetitive transcranial magnetic stimulation, it needs maintenance, meaning that the symptoms are lower, the person feels better, but after some time we have to repeat the train of therapies. The third highlight is use of psychotropics or more severe depression are negatively associated with outcome, which is new because many people believe that if you combine different approaches, like for example medication, psychotherapy and some form of stimulation, the outcome is better. No, they actually showed in this study that when a person is on medication and having transcranial direct stimulation, the effects are lower, meaning that medication is interfering with lowering the symptoms. The next is tDCS was well tolerated and no serious adverse effects were reported. The only adverse effects reported from the literature from before, because this is not new, that methods exists more than 100 years. Only the technology that we are using it is better and better. The thing is that you can sense a little bit current in the surface of your skin, and in the beginning of the application some people can report mild headache or something like that, but in general, this is very well tolerable and is considered to be non-invasive procedure. And in the end, tDCS is suggested to be a well-suited treatment alternative for depression. Meaning that in this publication, which was published just a couple of days ago, April the 8th, 2022, by Lokene, Markov, Nikander, Nuovonen and Dilkov in Elsevier Journal of Affective Disorder Reports. It is a very important publication because it shows for the first time how tDCS is actually almost twice as effective like medication, which is always the first choice of therapy on depression. So I invite you to read this publication to see yourself what the results are and to think about why in psychiatry not many applications of this are still ongoing, because we had the methodology, we know that it is non-invasive and it's present on the market. So I hope you would like this novel opportunity and that you're going to spread a word among people you know, because I'm sure that every one of us knows at least one person who is suffering from depression. Thank you for listening.